Hello and welcome to Mallige News. I am Aaron, your host. So, the top stories are the hiking of COVID-19 cases around the globe. Millions of cases have been reported and lakhs of lives have been lost. Now we have our reporter Karthik reporting live from
Yes, Lady.
Kerala.
The first human coronavirus was reported in Wuhan city, China. Almost all the cases reported in Wuhan has a direct or indirect link with the food wholesale market in Wuhan, thus revealing that the source for this virus was the market in Wuhan, or this market has played a crucial role in the initial amplification of the virus. So finally, the market was closed in 1st January 2020. So the genetic sequence study of the virus has revealed that all of these viruses have the natural ecological origin in bat population. Thus, it was suggesting that the virus is not a manipulated or man-made one. Since there is no direct contact between bats and human population, it is more likely that the transmission of the virus from the bats to the humans was through an intermediate host. It can be a domesticated animal or a wild animal or something like that. So now the entire world is under the lockdown. So we are fighting against this pandemic virus, and thus we are hoping that hopefully we are hoping that we will have a better life after all these efforts. And for Mallige channel, along with cameraman Deva, this is Karthik.
Thank you, Karthik, for giving us a brief report about what's the situation going around in India and other places of the globe. Thank you, Karthik. Hello and welcome to Mallige News. We have a few guests here. They are the lecturers of Mallige College of Pharmacy. We'll first call upon Mrs. Mamta MK, who is a lecturer of Mallige College of Pharmacy, practicing under the Department of Microbiology. And now, Mrs. Mamta, can you just explain us, can you just brief us about what is this virus and how, what all does it contain in it and what does it do?
First of all, thank you for inviting me. Today, I'll be focusing on the structure of coronavirus. Coronavirus are the positive sense single-stranded RNA viruses, which are about 120 nanometers in diameter. There are about 40 different varieties, and they mainly infect human and non-human mammals and birds. The virus that causes COVID is thought to be originated in bats, and then spread to snakes, pangolins, and humans. The word corona is derived from a Latin word, which means a crown. The corona-like appearance of coronavirus is caused by so-called spike glycoproteins or peplomers, which are necessary for the virus to enter the host cell. The spike has two subunits, namely S1, which binds to a receptor on the surface of the host cell, whereas S2, which fuses with the cell membrane. Now, the uncoated genome is transcribed and translated, which results in the multiplication of virus.
Oh, thank you, Mrs. Mamta MK, for briefing us about what the virus is. And I call upon Dr. Shweta Srinivasa, who is a lecturer of Mallige College of Pharmacy practicing under the Department of Pathophysiology. Ma'am, can you explain us how this virus affects our human body?
Yes, of course, Aaron. First, I would thank you for inviting me to this show. The SARS-CoV-2 virus, or commonly called as COVID-19 virus, is a positive sense single-stranded RNA virus which enters the human body mainly through respiratory droplets. When an infected person coughs or sneezes, the person releases the virus into air in the form of respiratory droplets. And these respiratory droplets remain airborne for about 3 hours and on surfaces for about few hours. And these droplets circulate with a radius of 3 to 6 feet. And when an unhealthy person comes in contact with these respiratory droplets, he himself inoculates him with the virus. And studies have also shown that the virus can also enter through fecal-oral route. When a person uses a toilet, he sheds the viral materials which are likely to be infective. And once these viruses enters the human body, it mainly invades to the respiratory system, in particular the alveoles. These alveoles are nothing but the air filtering sacs present in the lungs, which are mainly made up of type 1 pneumocytes, that is simple squamous epithelial cells, which help in gaseous exchange, and the type 2 pneumocyte, which secretes the surfactants, which decreases the surface tension and prevents from alveolar collapse. When these viruses mainly infect the type 2 pneumocytes by binding onto the angiotensin converting enzyme 2 receptors present on the type 2 pneumocytes with the help of S-spike proteins. Once this virus fuses with the host cell, it releases its genetic material into host cell cytoplasm. This genetic material then hijacks the host cell ribosome and synthesizes its viral proteins required for its survival. And it also uses an enzyme, that is RNA-dependent RNA polymerase enzyme, for the synthesis of its genetic material. Once the virus synthesizes all the requirements required for its survival, it then buds off from the host cell and it affects the other parts of the body. As this virus infects the type 2 pneumocyte, it causes the damage to it. And these damaged cells releases various sets of chemoattractants, which attracts the macrophages to the site of inflammation. These macrophages then releases various sets of cytokines like interleukin 1, interleukin 6, and tumor necrosis factor alpha, which signalizes the neutrophils to come to the site of inflammation. These neutrophils then releases other set of cytokines like reactive oxygen species as a defense mechanism in order to destroy the virus. But it ends up destroying both the type 1 and type 2 pneumocyte, which log off and deposit at the center of the alveoli as a solid consolidate, which decreases the gaseous exchange, causing hypoxia. As a result of this hypoxia, the chemoreceptors present on the blood vessels gets activated, which stimulates the sympathetic nervous system to increase the heart rate in order to supply more blood to fulfill the oxygen demand. And this consolidate also mechanically triggers or irritates the airway, causing cough. And these cytokines released also increases the vascular permeability, causing vascular leakage, which ends up causing alveolar edema, commonly called as pneumonia. And these cytokines may also reach brain, and it can stimulate the hypothalamus to release various sets of prostaglandins, mainly the prostaglandin E2, which result in increasing body temperature, resulting in causing fever. And this inflammatory response to fight against this virus is by our body is so severe that it ends up causing severe respiratory inflammatory syndrome and leading to septic shock. And this inflammatory response also causes increase in vascular permeability and decreasing the blood flow to the multiple organs, which results in decreased blood supply to these organs and finally leads to failure of these organs. This is how this virus replicates in our body and affects our body system. Thank you.
Dr. Shweta Srinivasa for briefing us about how this virus affects the body. And I call upon Mrs. Mamta back again. Mrs. Mamta, can you explain or brief us about how what are the diagnostic methods for this disease?
And yes, the infection can be diagnosed by antigen detection. Coronavirus antigen in the respiratory epithelial cells can be detected using ELISA with the help of specific monoclonal antibodies. And the next is electron microscopy. Coronaviruses can be detected using the electron microscopy, which usually appears spherical with a crown or club-shaped spikes on their surface. And the last is the RNA detection. As it is a RNA virus, reverse transcriptase polymerase chain reaction is used to detect coronavirus from a nasopharyngeal secretion, which is also known as a nasal swab. I therefore conclude that there's no such vaccine against COVID-19 till date, but social distancing is the best vaccine. Stay home, stay safe. Thank you.
Thank you, Mrs. Mamta, for briefing us about the diagnosis part for this disease. I call upon Mr. Saurav Guha, lecturer of Mallige College of Pharmacy, practicing under the Department of Pharmacology. Sir, can you explain us what are the medications? What is the use of medication? What does these medications do?
Okay, thank you, Aaron, first of all, for inviting me to this news hour. So I'll be telling you about some of the medications and their actions. That is how they act on the patient's body. So the first one is remdesivir. Remdesivir gets converted to remdesivir triphosphate, which acts as an analog of adenosine triphosphate, that is ATP, and competes with the natural ATP substrates for incorporation into nascent RNA chains by the SARS-CoV-2 RNA-dependent RNA polymerase, which results in delayed chain termination during replication of the viral RNA. The next drug that can be used here is hydroxychloroquine. As we all know, it is an anti-malarial drug that is used for treatment of malaria. So it exerts its effect by concentrating in the acid vesicles of the parasite. This parasite here is the COVID-19 virus, and by inhibiting polymerization of heme. So it can also inhibit certain enzymes by interaction with the DNA of the virus. So it is having some adverse drug reactions in here. That is adverse areas involved like thrombocytopenia, leukopenia, aplastic anemia, hemolysis, etc. Also other areas include those like vertigo, nerve deafness, ear deafness, and so on. The next drug that can be used is a combination drug, that is lopinavir and ritonavir, which is used in combination. It is a drug that is used for treatment of AIDS. Okay, so it is an antiretroviral drug. So lopinavir is a protease inhibitor. That is, it inhibits the cleavage of GAG polyprotein precursors, which in turn causes the formation of immature and non-infectious viral particles. The next one is the combination drug, that is ritonavir, which acts as a main antiretroviral drug in combination with lopinavir. Ritonavir inhibits metabolism to prolong action of the drug, and it also increases serum concentration. And the last and final drug that can be used here is ivermectin. That is, it binds to the glutamate-gated chlorine ion channels in invertebrate nerve and muscle cells, which produce paralysis and death of parasites. It is having some adverse drug reactions like hypertension is there, asthenia is there, mild EKG changes, headache, and so on. So thank you, Aaron, for giving such a chance. I can put my
Saurav Guha for explaining us about the actions of medicines. I call upon Dr. Manikanta, who is a lecturer of Mallige College of Pharmacy and practicing under the Department of Pharmacotherapeutics. So, Dr. Manikanta, can you just explain us what are the medications used and what does it do?
Yes, Aaron. First of all, I'm thanking Mallige channel for inviting me here. So, as we all know, the entire world is fighting against this pandemic, the COVID-19, and we all are in lockdown. So, my colleague, Mr. Saurav, has conveyed the information regarding the mechanism of action, side effects of the drugs used in COVID-19. So, now I will be focusing on the combination of the drugs and their indication in COVID-19. So, the first drug being the remdesivir. So, it is actually an antiviral drug that is given by IV infusion in hospital. It is a brand new drug that has not been approved by FDA, but it has shown to have some effect against severe acute respiratory syndrome. Thus, it has shown in preventing human cells from being infected with SARS-CoV-2. So, the next drug is the hydroxychloroquine and chloroquine. So, this is actually used for malaria and other autoimmune disorders like rheumatoid arthritis. So, here, hydroxychloroquine is more preferred over chloroquine because of its low side effects. So, why these drugs are used in COVID-19 treatment? So here, these drugs have their antiviral and immunosuppressant action, so which will be very helpful in the treatment of COVID-19. So the next, moving on to azithromycin. This is actually an antibacterial drug which is used in preventing bronchitis and pneumonia. So here, we are using the combination of hydroxychloroquine with azithromycin for the treatment of COVID-19, and it has shown almost 93% of success. So the most important treatment is the convalescent plasma. So what is actually this convalescent plasma? So it is a liquid part of blood that is collected from patients who have recovered from the infection. So what we are doing here is we are administrating first we are collecting the plasma from the recovered patients and we are transfusing this to the active patients, that is those with the active infection. So it has also shown a relief in symptoms like cough, fever, shortness of breath within 3 days. So moving on to the next combination, that is lopinavir and ritonavir. So this combination is sold under the name Kaletra. Actually, this Kaletra is an HIV medication, but it has shown some activity against severe acute respiratory syndrome, that is the COVID-19. So this Kaletra is more useful if we are giving a combination of Kaletra with interferon, beta-1D and ribavirin. Because in those clinical trials have shown that in those patients who have in which we have administered the combination of Kaletra with interferon, beta-1D and ribavirin, they have improved or they have recovered from the infection more fastly, that is within 7 days. But in those patients who have received the treatment with Kaletra alone has delayed their recovery, that is it took almost 12 days. So moving on to the last drug, that is ivermectin, so which is actually an oral medication that is used to treat parasite infections. So but the recent in vitro study has shown that it can stop SARS-CoV-2 from replicating. So I hope that we will get soon a good treatment for COVID-19, and hereby I'm concluding my words. Thank you.
Thank you, Mr. Dr. Manikanta, for briefing us about what these medications do and what are the medications. I call upon Mrs. Sheila Charan, who is a lecturer of Mallige College of Pharmacy, practicing under the Department of Pharmacognosy. Now, Mrs. Sheila Charan, ma'am, can you explain, just brief us about what are the home remedies, what a normal person can do to prevent such diseases in future?
Thank you, Aaron, for this humble invitation. Today, I would like to focus on the immunoboosters. Boosting our immune system is never felt important. Why? It can't stop us getting coronavirus. It can help our body to fight it. Rather terming boosting immune system, I prefer to use supporting immune system. Reasons why people immune systems are different from one another depends on the age, disease, pharmaceutical drugs, or the treatment like treatment for cancer that weakens the immune system. Here are some quick tips to improve our immune system to work better. First of all, one needs to opt a healthy choice of yoga, meditation, physical exercise.
Secondly, the food habits that includes the high polyphenolic compound rich fruits like apples, berries, cherry, raw mango, oranges, grapes, and veggies like broccoli, cabbage, corn, fennel, pepper, onions, and nuts, beans, almonds, cashew, flax seeds, and peanuts. And our beloved, that's the dark chocolate. It consists of 60% of cocoa. Next, a good source of fiber is also an important choice. That is, which improves the good bacteria in the gut that interact with the immune system to work better. Lastly, the oily fish, which is rich in omega-3 fatty acid for regulating and control of the immunity. The probiotic capsules are alive good bacteria that helps to keep our gut healthy. Next, commercially available probiotics are like yogurt, buttermilk, milk, raw cheese, and some fermented food like vada, idli, dosa, and douglas. And a good sleep and a stress-free life would also help a lot. So I here conclude that a positive attitude and a sweet smile is the biggest vaccine to present scenario. Remember, you are confined but not broken. Be strong. Thank you.
Thank you, Mrs. Sheila Charan, for giving us a delicious and good stress-free briefing about how we can avoid such diseases in the future. Thank you all lecturers of Mallige College of Pharmacy for joining us with Mallige News. Now we have few students of Mallige College who will be giving few points on awareness.
Social distancing is a practice of maintaining distance at the public places from the people to avoid the spread of infections. To this, please avoid public gatherings such as concerts, marriages, and parties. Whenever you attend a public gathering or crowded area, try to maintain a distance of 2 feet distance from the people. Whenever you visit a grocery store or medical store, make sure that you are wearing a mask and having a hand sanitizer.
New COVID-19 positive case has been reported in the locality. Transmission of COVID through pets. Hold breath for 10 seconds, and if there is no any discomfort that indicate you are not infected with COVID. Self-medication can cure COVID. Exposing to sunlight for more than 3 to 6 hours can kill the coronavirus. Guys, these are the fake news which are spreading more rapidly than coronavirus. So, please don't give attention to it.
Hand wash. Hand wash is a liquid soap used to cleanse one's hand. Coronavirus has a genetic material encased in a fat layer that is called the lipid envelope. Soap molecules are pin-shaped. Head that is hydrophilic and the tail that is oiliophilic. Oiliophilic portion of the molecules tends to have affinity to compete with the lipid envelope of the coronavirus, where it breaks the envelope of the coronavirus. Tails also compete with the bones that binds the RNA, thus dissolving the coronavirus into its commons, which is being washed with water. In order to carry out this mechanism, hands should be washed with the duration of 20 seconds. Hand sanitizer. Hand sanitizer is liquid gel used to destroy this infectious agents on hands. Among the sanitizers, alcohol-based sanitizers found to be more effective. The constituents of alcohol-based sanitizer are ethanol 80%, glycerol, hydrogen peroxide, and distilled water. Ethanol. Alcohol destroys the lipid envelope of the coronavirus and inactivate the virus. In addition, it also tends to change the shape or denature the mushroom tree protein that sticks out of the lipid envelope of the coronavirus. Hydrogen peroxide. Hydrogen peroxide kills the virus, bacteria, but it's less resistant to the bacterial spores. Glycerin. Jelly agent with glycerin helps to reduce the skin dryness. Hand sanitizer is found to be less effective if the hands are greasy or visibly soiled. Steps to be followed while using a hand sanitizer is: apply this product on the palm of the hand. Rub with the hand. Rub the surface of the hands and the fingers until the hands are dried. Do not go near the flame or burning objects while using hand sanitizers.
Cough and sneeze. COVID-19 is transmitted from the one person to another person. When one cough and sneeze, cover the mouth and nose with a flexed elbow or tissue after disposing it properly. If you are coughing in the mask and after, you must dispose it properly. And you don't cough and sneeze in your hand, then after the coughing and sneezing, don't touch the face with your hands. Then, if the coughing and sneezing worsen the condition, you go and check with your primary healthcare workers, and otherwise you don't take any home remedies for it.
How to correctly use a face mask. First, putting it on. With clean hands, fit the mask to cover your mouth, nose and chin. Second, secure it tightly to minimize the gaps between face and the mask. Third, once it's on, do not touch or adjust it. Wash your hands. Removal. Handling only the straps, untie or unlock your mask from behind and pull it away from your face. Do not touch the front of the mask, eyes, nose or mouth. Immediately throw the mask in the laundry or the brush. If it's intended for single use, wash your hands. Do always wash your hands before and after handling your mask. Do not reuse single-use mask. Wear a fresh one every time.
Hi guys, we know that these days we are facing COVID disaster. We cannot fugitive with this catastrophe. We should fight against this crisis by staying at home. So friends, how can we stay safe at our homes? First, be in quarantine for 14 to 28 days so that we can control the spread of this disease. Secondly, do not go outside unnecessarily. Finally, pull yourself together and be optimistic. Stay healthy and stay safe.
And that's all for now. For more updates, keep watching the news. Signing out, Aaron.